Welcome back. Health Minister Dr Joe Phaahla gave an update on the state of the healthcare system in the country on Thursday. After the National Health Council met for their third meeting of the year, Phaahla touched on a range of issues affecting the department. These ranged from the financial state of the department to the introduction of new vaccines to combat COVID-19. He also provided tips on what to do if one suspects that they may be infected by the current avian flu virus. Dr Joe Phaahla said the department is set to destroy 3 billion rand worth of COVID-19 vaccines at the end of the year, as they would have reached their expiry date with little uptake from patients. The minister acknowledged that there were some problems with payment to service providers, service delivery and improvement of infrastructure. He said, however, that great strides have been taken to ensure that they use the budget given to them for the programs planned.
Specialists at NICD have been doing some work in terms of this. Now, what they have reported to us is that persons with known or suspected close contact with dead or sick birds from avian flu and who present with upper or lower respiratory tract symptoms or conjunctivitis, that the infection of the eyes, should seek medical attention. All individuals exposed to avian flu should be monitored for 14 days for respiratory symptoms and be encouraged to seek care as soon as possible once they experience certain symptoms.
For more on this, we are now joined by Dr. Kgosi Letlape, and he is here to weigh in on the National Health Council outcomes. Dr. Kgosi, thank you so much for joining us here on the late edition. Of course, we saw the outcomes of that meeting, which took place, the National Health Council meeting. I know that there's been a number of things that, the minister pointed out to in terms of, what needs to change. But when you look at the outcomes, what would you say stood out for you?
Well, some of the things that stood out for me was the reduction in available resources and just a bit of a concern about reducing the HIV budget and the infrastructure budget, given the state of our hospitals that need refurbishment, resources to revitalize them. So that's, and I'm hoping that the budget might look at savings in terms of non-essential administrative support. We could ensure that people living with HIV continue to get the medications that they need. And if lower prices for the cost of ARVs, nobody behind.
And Dr. Kgosi, I'm going to ask you to just speak a bit closer to your mic because we seem to be losing you there, as you respond. Another thing that I'd like to touch on is, some of the immunization or vaccines that the minister also spoke about the introduction of these vaccines, like the likes of the whooping cough and, other vaccines to treat some of these diseases. Would you say that this is something that South Africa urgently needs with, these new vaccines or the immunization?
Well, the vaccines, those are old vaccines, and we've done well in terms of the percentage of kids that come up for vaccination. And we should applaud the efforts that more of those be sourced. What we should be concerned about is the challenges that we have in terms of uptake of COVID-19 vaccines. And we need to be seriously looking at what the costs for the decreased uptake. The fact that we have not vaccinated enough people and we're destroying stocks of vaccines should be something that concerns us. And we should deal with simple and all the other factors that contribute to the decreased uptake.
And Dr. Kgosi, I mean, we've even heard from the minister that, the amount of COVID-19 vaccines that will be destroyed, we know that some will be destroyed towards the end of October, and the last batch will also then be destroyed in early February. When you look and, we understand this is basically worth 3 billion rand, which will be destroyed. What lessons can be learned from COVID-19 vaccines, especially if the country has spent so much money, and we also talk about many problems in the healthcare sector that sort of money could have gone towards?
I think it goes to the issue of the pressure of purchasing under emergency authorization, and that we've allowed the pharma companies to get away with murder, as far as I'm concerned. Because there should have been arrangements for them to take the vaccines back when they are close to the expiry date and reimburse us. And I think those are some of the issues that we should have left about procurement. The second issue is about greater transparency. There should be no confidentiality that is entered into with pharmaceutical companies when we purchase, so that we do not have a trust deficit between ourselves and the Department of Health. We should welcome the fact that for private acquisition of vaccines, but we should ensure that once they are privately acquired, do not have members who are on medical aid and using private facilities not having access because of excessive pricing by those that have acquired the vaccines.
While the minister also raises problems around the avian flu, that has rocked South Africa and, the rest of the world, something that has also been touched on is the issue around, having some sort of a vaccine. I mean, this has basically had a major impact on the agriculture sector when it comes to avian flu. It is also subsequently affecting the economy. What are your thoughts around South Africa trying to find their own vaccine when it comes to dealing with avian flu?
I think H1N1 is a global problem. So there's no country that's going to pursue getting a vaccine on its own. And as we've seen with COVID, we're part of a global effort. And I hope the department and the institutions that do research continue with global collaboration on the pursuit of vaccine. But more importantly, we should be more vigilant about early detection so that we ensure it does not spread through livestock. So when we have farms that are identified, there should be proper quarantine and disposal of those animals. But more importantly, as the minister has said, we should not forget the importance of basic hygiene. Those that handle animals should ensure that they have the appropriate protection in handling the animals. And that once they've handled the animals, proper handling is essential, so that whatever they may have picked up on their hands not transfer to other objects, to other foodstuffs, and to other people. So basic hygiene becomes important, detection becomes critical. And collaborating with other nations in terms of looking for vaccine is critical and is important.
And Dr. Letlape, something else I would like to deal with is, of course, the National Health Insurance Bill. And, of course, we understand that has since, been signed by the National Assembly earlier this year. But, while we deal with the NHI, at the same time, there have been concerns raised about its shortcomings. Before it comes into law, do you think that this will be something, when it comes to its shortcomings, that can be dealt with before it is implemented?
I think it really depends on the ministry, that all the inputs that it has received, it attends to. All the shortcomings that are being highlighted, should be money, and they should discuss the proposed solutions, people that have highlighted the shortcomings. But what is of great concern is that NHI is a funding mechanism. Now, when you have the finance minister seeming to be out of step with the health minister on a financing mechanism, that is alarming and concerning. So we need greater detail of how it is going with financially.
Yeah.
What will be the rate? Will it be like tax, etc., etc.? And the current bill is not, it's thin on those type of detail.
Yeah.
For a funding mechanism that does not tell you whether you're going to be taxed, how much you're going to be taxed, becomes concerning.
All right.
And the biggest issue that the ministry should address is the issue of how do we manage the current health port. So there should be emphasis on a better running public healthcare system and value for money on medical aids for members of medical aid.
All right, then, Dr. Kgosi, thank you so much for your time and for your contributions here on the show. That is Dr. Kgosi Letlape there, just giving us his insight when it comes to that meeting and the outcomes of the meeting that was held with the Health Minister on the National Health Council.